CMA Talk is the number to get on the line with Dr. Missy Graham. We thank you for being here again today.
Thanks for having me, Melinda.
We were just saying kind of everything drying up and dying is kind of a good thing for allergy sufferers.
It's pretty good for all the sneezing. With all this this bad weather as far as the ozone layer, it's bad for breathing, but better for sneezing.
Okay. Better for sneezing, but bad because of the ozone layer makes it hard to breathe if you have those problems. Okay, let's get started with the phones, and Kim is up first from Little Rock. Hi, Kim.
Hi.
Hi, go right ahead.
Yes, I have a 6-year-old, and he has to have allergy shots every week, and he is deathly afraid of needles. And it takes me and a couple of nurses to hold him down, and I'm starting not to like that because it hurts him so much. And I was wanting to know if there is an alternative to the needles, to the shots.
Okay. Well, Kim, that's a good question. There are some alternatives to needles, but they're not FDA approved right now. At some point, there may be allergy drops. Some doctors are doing them, but board-certified allergists haven't started that yet. They've been out for a long time. The shots still work the best, and the needle is really tiny, so it's not that it's a painful procedure. It sounds like he's just very scared of it, and sometimes when that happens, we just have to wait a little while until the kids can tolerate it better. But, you know, if you give him a few tries, sometimes it'll get better.
Yeah, maybe even show him how tiny it is or something like that, you know.
Yeah.
Okay, well, good luck. We know that it's hard. Okay, Tatricia from Jacksonville is up next. Hi, Tatricia.
Hi, how are you?
Doing well. We're glad you called.
My question is, what else can I do? I take all these inhalers, and every time I have an asthma attack, I do all these steroids, constantly gaining weight with it. And, I mean, everything I go to do is so strenuous, and I'm so afraid to have another asthma attack. What else can I take, or what else can I do?
Well, Tatricia, it sounds like if you're not already, you need to be seeing an asthma specialist. Usually it's not impossible to keep your asthma controlled. It's usually a lot easier than what it sounds like you are experiencing. So make sure that you're seeing an asthma doctor. That would be either a pulmonologist or an allergy and immunologist. A lot of times allergy plays a big trigger. So if you've seen a pulmonologist, then you might see an allergist this time and just get a better treatment plan. A lot of times if you take care of the allergy, the asthma will get easier to treat.
Okay, very good. Good advice. Thank you so much, calling. Anne is up next, and she's in Cabot. Anne-Marie. Hi, Anne-Marie.
Hi, good morning.
Hi.
I have an asthma question.
Sure.
My daughter is 6 years old, and she's been on asthma medicine since she was 2. Can these medications affect her growth?
How did you say she was 6? Is that what you said?
6 now.
Well, it's very rare for asthma medications to affect your growth, but in high doses, the inhaled steroids are the only ones that could affect the growth. And usually that's just a very short-term issue, just up to a couple of centimeters, but they will reach their adult height. But whenever someone is on inhaled steroids, the doctor should be plotting their growth chart very carefully, and if they see any issues, then they can change the medication. But most of the time it doesn't cause any side effects because those medicines go into the lungs and they don't get into the bloodstream, so they're fairly safe.
Okay, that's good to know. Absolutely. Thank you, Anne-Marie. We appreciate it. We're going to get to Nelda. She's on the line. You may be our last caller today, Nelda, but you got in. Hi.
Hey. I want to know how she feels about herbs for allergies and sinuses.
That's a good question. A lot of people are interested in alternative medicines, and I think you asked about herbs for allergies and sinuses. There have been some studies that have shown that these may be helpful. The main issue that I see with these medications is that they're not regulated by the FDA, so they may not be without heavy metals and things like that, and we don't know the appropriate doses. But it's still certainly something to look forward to in the future, and maybe that will get worked out. But all medications are herbs. They come from plants. So medications, you just have to make sure that they're regulated.
Right, make sure that it's safe. Okay, thanks so much for calling. Quickly, back to school time.
Yes.
Parents need to think about getting into the doctor so that everything's ready for school.
That's right. If you have a child with asthma or food allergy, every one of them will need a food allergy action plan or an asthma action plan. So right now is the time to call your pediatrician or to call your allergy and asthma doctor and get in for that yearly checkup.
Yeah, is this something that most schools require?
Yes, all schools require it if they need an asthma inhaler or an epinephrine EpiPen injector.
Right. And that's something to think about when you're thinking about school lunches and all of that. Anything that could harm your child.
That's right. If you can get that asthma plan and food allergy plan done, then you'll have a lot easier back to school time.
Okay.
You won't be screaming to the doctor.
Very good. All right. Well, great advice. Let's put up the information, of course, about the Arkansas Allergy and Asthma Clinic over there on West Markham, Suite 222, Little Rock. 227-5210 is the number, and this may be a good time to get in because she says sneezing is down.
That's right.
If we get rain, though, a little bit of mold, we could have problems again with people who suffer from
In
that.
Arkansas, we have trouble just about all year long, but this is just a little bit better time.
A little bit of a break.
In the dead of winter, those are the two times.
When everything outside is dead. Thank you so much. We appreciate
Thanks,
you being
Melinda.
here. Dr. Missy Graham with Arkansas Allergy and Asthma Clinic.